food safety, sanitation, and personal hygiene.
How to aid cut. First, wash your hands. This helps avoid infection. Next, stop the bleeding. Next, clean the wound. Next, apply an antibiotic or petroleum jelly. Next, cover the wound. Next, change the dressing. Next, get a tetanus shot. And lastly, watch for signs of infection. How to aid blister. First, wash your hands and the blister with soap and warm water. Next, swab the blister with iodine. Next, clean a sharp needle with rubbing alcohol. Lastly, use the needle to prick the blister in several spots near the edge and apply an ointment such as petroleum jelly to the blister and cover it with non-stick gauzy bandage. How to aid first-degree burns. First, cool the burn. Immediately immerse the burn in cool tap water or apply cold wet compresses. Next, apply petroleum jelly 2 to 3 times daily. Next, cover the burn with a non-stick sterile bandage. Next, consider taking over-the-counter pain medication. And lastly, protect the area from the sun. How to aid insect bites and stings. First is, wash the affected area with soap and water. Apply a cold compress such as a flannel or cloth cooled with cold water or an ice pack to any swelling for at least 10 minutes. Raise or elevate the affected area if possible, as this can help reduce swelling. How to aid snake bites. First, lay or sit down with the bite in a neutral position of comfort. Next, remove rings and watches before swelling starts. Wash the bite with soap and water. Cover the bite with a clean, dry dressing. And lastly, mark the leading edge of tenderness, swelling on the skin and write the time alongside it. How to aid nosebleeds. First, use your thumb and index finger to pinch your nostril shots. Breathe through your mouth. Continue to pinch for 10 to 15 minutes. Pinching sends pressure to the bleeding point on the nasal septum and often stops the flow of blood. How to aid severe choking. First, stand behind them and slightly to one side. support their chest with one hand. Second, give up to 5 sharp blows between their shoulders blades with the heel of your hand. Third, check if the blockage has cleared. And lastly, if not, give up to 5 abdominal thrusts. How to aid shock. First is seek emergency medical care. Keep the person still and don't move him or her unless necessary. Begin CPR if the person shows no signs of life, such as not breathing, coughing, or moving. Loosen tight clothing and if needed, cover the person with a blanket to prevent chilling. Don't let the person eat or drink anything. There are techniques in bandaging. First, keep in mind the following. Always use a square knot. Keep the cloth sterile to avoid infection. Always keep the ends. Second, bandaging technique depends upon the size and location of the wound, your first aid skills and materials at hand. Next, bandage firmly over bleeding and securely over the broken bone, not so tight so as not to cut off blood circulation. When wrapping bandages around the body, such as knees, ankles, neck, and small back, use its natural hollows to slide the bandage gently into place. Since most injuries swell, check regularly to ensure that the bandage is still comfortable and that it remains firmly secured. Secure the bandage with a tape, clips, or a bow or square knot. Ensure that the bandages, especially the knots, do not touch the skin. How to do a square knot. And here is an examples.
Prevention is better than cure.